Make sure my tie is straight. Well, thank you everybody for joining us for our second healthcare action update. These updates let you hear directly from government and the Provincial Health Authority on and from subject matters such as Mr. Johnson and Dr. Parfrey, who are here today, on areas that impact healthcare that you receive, like healthcare appointments, which is the focus of today's update. Additionally, our website, thehealthcareaction.ca, gives us a chance to provide more details on our plan to improve health in Newfoundland and Labrador. For example, the latest numbers on healthcareaction.ca show that 28,895 residents are now attached to family care teams, and that 63 medical students and residents are being offered bursaries to practice here in Newfoundland and Labrador. Expansion of family care teams and recruitment and retention initiatives. By the way, I'm happy to inform you today that approximately 200 of this year's nursing grads have accepted employment with Newfoundland and Labrador Health Services. So these updates are some of the many initiatives of our plan, which is built on the foundation of the Health Accord. Your health, our priority, and this is what we are doing. We are working hard to improve access and efficiencies. In today's update, we want to talk about missed appointments, what that means to our health system, and how we as a government and a provincial health authority can do better. How all of us as residents can do our best to help reduce wait times by keeping medical appointments. To gain a better understanding of the extent of missed appointments, I've asked for an indication of the number of missed appointments as well as an analysis of the policies and procedures regarding appointment utilization across Newfoundland and Labrador. The results were both enlightening and shocking. It became clear that there was a lack of consistency in our missed appointment policies across the province and even within hospitals. And that is why, as a government and now as one provincial health authority, we are taking action to improve appointment scheduling operations. We can make improvements to our policies and procedures, including a consistent policy province-wide. And we can improve on how we remind people of their appointments. And that's where we're going to start. What this does and what it means to our healthcare system in our province. Wait lists can be reduced with policy improvements and reminders. It means that your mother, your brother, or child can get a procedure sooner. It means literally tens of millions of dollars that can be better utilized in our healthcare system. Here's a snapshot of what missed appointments look like. Approximately 20 to 24% of Holter monitor appointments are missed. That is almost 1 in 4 appointments. EEG, the equivalent of 1 day per week in missed appointments. Pulmonary function, 17% missed appointments. Lab services, 10%. Ultrasound, 10%. Cardiac ambulatory clinics, 10%. And even our new family care teams have a 10% rate of missed appointments. If we can reduce the number of missed appointments, that directly reflects on wait lists. If we go from 10% missed appointments to 2%, that's 8% more people that we can see and service. If we see 8% more people for a procedure, we also have better use of our resources and a more efficient operation. We've talked about how the Health Authority can help reduce the number of missed appointments, and when Ron speaks, he will add to this. provide greater details on the topic. We can, as residents, also do our part in helping ensure we keep our appointments or cancel them at the earliest opportunity. So if you can't make your appointment, somebody else can. Of course, understanding that there are extenuating circumstances where missed appointments cannot be avoided. We know that everybody's lives are busy. We know that there is work, sports practice for our kids, thinking about what you need to pick up at the grocery store, and on top of that, we have healthcare appointments to keep track of. It can be especially cumbersome to keep track of medical appointments if you or someone in your family has medical issues that require an array of healthcare services. And missed appointments can take a toll on your health and the health system at large. As I'd indicated, the monetary cost for missed appointments is in the tens of millions of dollars. It's difficult to measure, but it's probably a couple of $100 million. When the real cost of missing an appointment is measured, it's your care that is delayed or the care of somebody else on the wait list. To provide efficient and more modern reminders, the Provincial Health Authority has adopted the automatic notification system, which is an electronic system used to provide phone, email, or text reminders for non-urgent in-person appointments. For example, you'll receive a notification on your phone reminding you to confirm or cancel your appointment. It is currently in use for a number of programs and services, but it will be expanded over the coming months, and it will allow for a better management of appointment times for you, your families, and for your healthcare providers. We are also working with the Newfoundland and Labrador Health Services to develop a standard provincial policy for missed appointments and a plan to integrate the appointment scheduling into the new digital health information system, which is being developed as recommended by the Health Accord. It is our hope that collectively these efforts will cut down on the number of missed appointments with the goal of making your health experience better. By working together, we can do more to deliver better health care. When your next appointment is scheduled, make sure that the Newfoundland and Labrador Health Services has your most up-to-date contact information for you and your family. Make every effort to attend your scheduled appointments or to cancel them if you're not able to make the appointment. To help us achieve our goal of reducing missed appointments, we will be launching a public awareness campaign of the impact of missed appointments. In closing, I recognize that the Health Authority can and are doing more to create efficiencies and remind people of appointments. As a population, we can try to ensure that we either keep or cancel appointments. The benefit is faster service, shorter wait lists, and health system efficiencies. Everybody wins. I'll now pass it over to Ron Johnson, Vice President and Chief Operating Officer of Eastern Urban Zone, for some comments.
Thank you, Minister Osborne, and thank you for raising this topic. It's certainly one that we can make a difference in. So Newfoundland and Labrador Health Services is working with the provincial government to improve access to quality of care for all Newfoundlanders and Labradorians. I mean, we have the Health Accord, and that recommended the consolidation of the 4 regional health authorities and the Centre for Health Information into one provincial health authority. That provincial health authorities makes it easier to get at topics like this, to be able to standardize, right? So one of the ways we're doing this, as Minister Osborne raised, is through this automated notification system. It's an electronic system, and through that system, it actually provides reminders via phone, via email, or text to remind you of your non-urgent in-person or non-urgent, non-emergent in-person appointments. It's already in use, as the Minister indicated, in a number of programs. It's been in use in endoscopy, medical imaging, cardiac, and pulmonary services. Now, we've had some great success with this. Prior to COVID, we've seen in some areas where we implemented this reductions in missed appointments from 30 to 50%. And I'm very proud to say that we're going to be rolling this out to all remaining clinical areas in the province. That expansion has started. We have a couple of programs now that we're working on, neurology and nephrology. We will get them implemented within the next 8 weeks. So we know that traditional appointment letters, they can be misplaced, they can be lost, right? It's not very efficient. So with ANS, you get to choose how you want to be reminded of your appointment. So when you register, you will provide information such as your email, your phone number, and your text information, and you'll get to select how you want to be reminded. We're also working on a redundant system where you'll get 2 reminders. You'll get a reminder phone and text, so it'll make sure that you don't miss your appointment. Now, the technology is only one piece of this, right? So there's other factors at play. So that's why we're developing a policy, as the minister indicated. That policy will be implemented within the next 6 months. That policy will be comprehensive to get at all the reasons why people miss appointments. We know from a previous survey, we surveyed patients previously, we know that people miss appointments for transportation issues. Sometimes they have confusion on how to contact their provider. We know that sometimes there's parking problems, inconvenient times, and sometimes they forget, right? So it's a various reasons. But we also know that the existing policies add within the within the existing legacy regional health authorities, they add another layer of bureaucracy, right? So we're trying to rip that down in this new policy. So just to reiterate what the minister said, if you cannot make your appointment to the public, please let us know so that we can reschedule it. So somebody else can get that time slot, right? As Minister Osborne indicated, we're all in this together. So I'll now pass it over to Dr. Parfrey.
Thanks, Ron, and thank you, Minister. I'm here because of my role in trying to implement the actions recommended by the Health Accord. And I think that the first piece to pick up from this is that this intervention is directly connected with one of the major things that the Health Accord recommended, and that was action on quality. And one of the major elements of quality is timeliness of access to healthcare. I keep saying that time is healthcare, and it's not only time to getting your appointment, but it's the time where you're present at your appointment. And if missed appointments are there, it influences the effect of other patients getting access to care, and it influences the amount of time that's spent for the particular test or for the particular doctor, etc. The other piece that we've emphasized in the Health Accord was that embrace digital technology. It is a solution for our province, both for virtual care and in this instance, in being able to help us and the system to be able to deal more efficiently with patients and their problems. And the last thing is, at the Health Accord, we made a very strong emphasis on getting the right intervention to the right patient at the right time. And if your wait lists are influenced so strongly by missed appointments, it is not possible to get that type of clinical efficiency. And I strongly believe that this intervention will help us get the right intervention to the right patient at the right time.
Well, thank you. We'll open it for questions.
Minister Osborne, what's the cost associated with this expansion?
Well, this is built into the budget within the Health Authority, the Provincial Health Authority. Right now, as Ron has indicated, there's already a number of services. It's not consistent across the province. There's a number of policies which is not consistent across the province. So some of this is simply, having a consistent policy throughout the entire province, so that regardless of where you're living, the policy and the procedures for a missed appointment or for your scheduling your appointments and whether or not you miss an appointment will be consistent. It's one set of policies, one set of procedures for everybody, regardless of where you're living. The other aspect is, as the Health Authority rolls this appointment process out to all services, we will see a more efficient system. It will help us reduce wait times for all services in the province. And as I'd indicated, government, the Health Authority recognize that we can do better here. We've started taking action. We're going to have the communications campaign to inform the general public of how they can play a role as well by making sure that they either keep their appointment or cancel it, which will also help the Health Authority put those efficiencies in place. Ron, did you have anything you wanted to add?
Yeah, so on the budget itself, so right now it's 8 cents per text message. So last year, looking at the existing services that we had out, we spent around $3,200, about 40,000 messages, right? So it's 8 cents per text message each reminder.
Can you speak to the, because we talked about, we saw some of the stats earlier about the rates of missed appointments in some of these departments. How do you think this will impact, I guess, the level of frustration that some healthcare providers are feeling, knowing that, you know, they're trying to fit in, they're trying to get rid of these backlogs, and then there's this significant amount of their time, I guess, that is being wasted on missed appointments. Can you speak to, I guess, that aspect of it?
Yeah, I think, you know, all three of us can probably speak to that, but, you know, our healthcare professionals in the province are putting the health of individuals first and foremost. We can all play a role as residents of the province by keeping our appointments or cancelling them so somebody else can take that appointment. When you've got a specialist, you know, whether if it's a cardiac specialist who sees a wait list and they know they want to get those people looked after, you know, if we've got 10 or 15 or 20% in some regions of the province that are missing their appointments, we can shorten that list by 10 or 15 or 20%. If we can, as a health authority, better manage the appointment system, better remind people, and as residents, making sure that if something comes up and we have to cancel the appointment, you let people know. As Ron has indicated, the text messages will allow an individual to say, yes, I'm going to make the appointment, or no, I can't. And right at that moment, you know, if the message comes back that they can't make it, the health authority can then reschedule somebody else, so it does shorten the wait list. You know, so for our health professionals, this is going to be a benefit as well, because they don't want to see missed appointments, which leads to an extended wait list, because not only is it not somebody coming off the wait list who can fill the appointment, but the person who misses their appointment has to go back on the wait list as well.
Has there been a review of missed appointments in the province before now? Like, do we know if we're seeing a lot more missed appointments over the last number of years than we would have 10 years ago? Or
Ron may be able to speak to that. I know that, you know, the reminder system was, the health authority were starting to use it, and during COVID put it aside, and has since started to reintroduce that, Ron. So
Yeah, so we started to use this prior to COVID, and then life got in the way with Snowmageddon, COVID, and we couldn't be putting out reminders for appointments that are not available, right? So we had to turn it off. So now we're back at it again. There has been reviews previously to look at missed appointments. I would say the rate of missed appointments is about the same as it always has been. There's no big difference. Those reviews will help us with the policy, right? So we have information, as well as other jurisdictions, as well as the literature, because we are a learning health system. So we'll use all that information to create a policy that gets at all the pieces that causes people to miss appointments. Right.
If I could ask Dr. Parfrey a question. Dr. Parfrey, as a nephrologist, what would this mean to you, people missing their appointments?
I think maybe I'd answer that as a doctor having a clinic. So I have a wait list for I used to have a wait list when I was a doctor for my clinic, and you try to see as many in the 3 or 4 hours that you've got the clinic as you can, and if somebody doesn't turn up, that's 15 minutes. You finish earlier, but it's 15 minutes where that person that's of last time and somebody on the wait list could have been seen, For the tests that we order, though, it's a bigger problem, because if we order a test for somebody that we really want to have a Holter monitor done and fairly quickly, and it's a big wait list, and it can't be done, and you wait for longer than you hope to wait for, and some of these Holter monitors have missed appointments of 20%, that affects the capacity of the person who really needs it to get it. And I kind of understand the situation of the Holter monitors. That's done to look at the rhythm of your heart, and sometimes people get abnormalities in the rhythm of their heart that just goes away, and the patient doesn't think about them anymore, and they say, oh, it's gone, I'm not even going to work, and then they forget about the appointment, but it's still booked, and that missed appointment for that, at that particular time affects the people on the wait list. And that's the piece that needs to be fixed.
And for patients, I imagine it would change the outcome for the people who miss appointments, but also for those who are on a wait list. Maybe you could talk about the outcomes of patients and how it's affected by missed appointments.
Well, to some extent, it depends on the test. And really, the people that we're most concerned about are people who are of high priority and that they need that test within the week. And if that wait list is booked out, then that person is going to be disadvantaged by not being able to get to that urgent test that they need. And I do think that this capacity to electronically better control what's going on is going to ultimately lead to decreased wait lists, but also allow patients who urgently need a test to be able to get it done faster.
And I guess to put it in another way, if with Holter monitors, if we were to say we were going to shut that clinic down one day a week, people would be shocked and outraged. But essentially, that's what we're doing. Mm-hmm. With 20 to 24% missed appointments, that's essentially what we're doing. Or a new family care team with 10% missed appointments is the same as shutting it down one of every 10 days. People would say, well, there's people on the wait list, people without a physician. We need to get in. So we'd like to better be able to utilize that time. By providing appointments, we can remind people, or by providing reminders, we remind people. So we can do a better job of reminding people to make sure they don't miss the appointment. And we're going to put out the public relations campaign to remind people of the cost to the system of having those wait lists, the cost of the system in terms of inefficiencies, but also how they can cancel the appointment, and allow the health system to better utilize that time.
Minister Osborne, you mentioned in the event of a cancellation, the next person on the wait list will get notified. Does that happen immediately, or is a couple of hours?
So Ron is probably better to speak to that.
Yeah, so with the electronic communication, it happens immediately. So immediately we know who declined. So then what happens daily, a report is ran, and then the next person is contacted. That's how it works. Otherwise, if we never had this, you imagine that we don't, basically that slot is left empty and no one shows up. And the provider is there seeing nobody.
It's mentioned that this is for in-person appointments only. I know that government is really pushing virtual care across the province. Does this factor into virtual care appointments in any way?
We can have a look at virtual care as well. We've got an RFP that's coming out now on virtual care, but that's more of a call-in system where anybody who doesn't have access to a family physician or primary care will have access to a physician virtually. It will also provide oversight to our Category B sites. If there's no physician available, we can have a physician available virtually and keep the doors open so they don't have to go on diversion. But it's certainly something we can look at. Virtual care is a little different than in-person care, but we can probably apply the same policies and procedures in some cases with virtual run.
I would think so. I mean, the technology itself would lend itself to virtual. Again, it's just a matter of how we want to use it.
Is there any advice for someone who might be canceling an appointment, how much time that they should give to notify that they're going to cancel their appointment before their appointment? Is it 24 hours?
Well, I think as quickly as possible. So that the reminder system, they will have an opportunity right away. If they book something else, or if they no longer need the appointment, they get a text. They either respond that yes, they want the appointment, or no, they don't. Even after that, if something comes up, a family emergency, a death in the family, you have to travel unexpectedly, whatever the reason, that text is then gone. So they can no longer respond to the text to say, well, no, I'm not going to make it. So we will provide information as well on how people can then cancel by contacting client services. So as soon as somebody realizes they can't make it, life gets in the way sometimes and people can't make it. So as quickly as they can possibly notify, that slot then can be used for somebody else.
And I guess that 2% rate that you're hoping to get to, would that kind of account for unavoidable cancellations? Is that what that
It would, yeah. I mean, if you look at an airline, you book an airline ticket, they're probably 2% or less of people not showing up. But that's because you pay $800 or $900 for an airline ticket and you're not going to miss the appointment. You don't pay for an appointment within the healthcare system. So sometimes you don't realize, there's a cost if I don't let them know. But there is a cost, not only, literally tens of millions of dollars, but you could be helping somebody who's on the wait list get in sooner. So, that's part of the campaign to let people know that, there are efficiencies and it helps everybody. And it could be, a loved one that gets in sooner by somebody when they cancel an appointment, letting the health authority know.
When was this review completed? It says recent, but is it last week or earlier this year? And by who?
So I'd asked the 4 health authorities to provide me with some information on the amount of missed time, and that was back in November, December. And since that, we've been speaking with the health authority on, how do we fix this? So we've been working together, the health authority. The real opportunity came with bringing the 4 separate health authorities together as one. Now the health authority has the opportunity to put in a province-wide consistent policy and procedures, as well as the reminder system. We had a fragmented system before, and Dr. Parfrey and Sister Elizabeth in the Health Accord, one of the recommendations was creating one health authority. It is for this is one of the many reasons why that makes sense, because we can create those efficiencies in terms of policies, procedures, and operations.
In the policy, you mentioned there's obviously a cost, but to the individual who misses an appointment, it's maybe not obvious what the cost is of missing the appointment. Would the policy have something that would, I don't want to say penalize, but cost the patient something, not necessarily monetarily, but cost them somehow for missing an appointment?
I don't think so. Certainly that's not something we had contemplated. I think, many times, I've missed appointments in the past, so we probably all have in this room, if we were going to be honest with each other, we've missed appointments in the past. It's just a matter of life. But like I said, you don't miss your airline appointment unless you're in an accident or there's a death in the family or there's some real reason. So better educating the population as a whole as to the fact, because yes, it is tens of millions of dollars. It's hard to measure. It's probably a couple of $100 million is the cost of the system, but that's not the most important cost. The most important cost is the fact that we have a wait list, and the health authority doing a better job of informing people of their appointments by sending a text that they can respond to. It's not just a one-way text. They can actually respond and say, yes, I want the appointment, or no, I don't. And then, having a follow-up to that. I know my chiropractor, I get 2 texts, one, probably 4 or 5 days ahead of time and one the day before. And the reason I guess they send out 2 is life gets in the way. So the day before they send out a reminder. We can look at those things as well within the health authority. Instead of 1 reminder, maybe it's 2 reminders. And I know there's a cost to that. It's 8 cents a text, so it does get costly. But the cost of having a wait list means that people are waiting for services, and that's the biggest cost. Okay, well, thank you.